Whether it's sleep apnea or seasonal allergies, millions of Americans deal with some kind of breathing issue. To alleviate these problems, many turn to surgery. In fact, one of the most common nose procedures fixes blocked nasal passages. The effects can drastically improve a patient's quality of life, but in some rare cases, people are left feeling like they're constantly suffocating. The condition, called empty nose syndrome, affects a very small number of patients, but is a disorder that's been the cause of suicides and even murder.
This guy ended up getting empty nose syndrome. He kept going back to the surgeon, and the surgeon told him there was nothing wrong with his nose, which is a very common thing. And he eventually murdered the guy, and then they actually ended up executing him later on because he had murdered his doctor. So it was a very sad story. You have this minor procedure. You then come away basically crippled from it, and you go back to doctors looking for help, and they basically tell you there's nothing wrong. And so if you look at a lot of the ENS online forums, there's a lot of really angry and desperate people.
That's James R. Skinner. He suffered from terrible sleep apnea and nasal congestion for years before deciding to go under the knife. Skinner lives in a rural town in Nova Scotia, Canada, and had to travel to the U.S. for 2 procedures.
After I had those surgeries, he said, I've taken the nose as far as I possibly can, and that I shouldn't have any more nasal surgeries. He actually at that time mentioned the risk of empty nose syndrome.
And though he says the procedures helped a little, Skinner continued to battle his sleep apnea over the next 2 years. When it became unbearable, he sought out a doctor near his home in Nova Scotia.
I was actually quite desperate to get the sleep apnea under control, and we were exploring possibilities of surgeries for that. Anyway, he felt at that point that I was still having enough troubles with my nose that I should have another procedure on my nose. I explained to him at the time that I had been told in the US that it would be unsafe to do so, but he felt that it was safe and went forward with it. And unfortunately, that's the procedure that ended up giving me empty nose syndrome.
Empty nose syndrome, or ENS, was first discovered in 1994, though much of the condition still remains a mystery to this day. Dr. Brent Sr. has researched ENS for several years as chief of Rhinology, Allergy, and Endoscopic skull-base surgery at the University of North Carolina, Chapel Hill. Sr. says doctors aren't completely certain what causes the disorder.
There are theoretically people that can have empty nose that have not had surgery, but probably 99% of the patients who do develop this very unusual condition have had surgery of some sort on their nose and sinuses.
ENS symptoms can range in severity, but many who suffer with the syndrome report a chronic feeling of suffocation. Even though the nasal passage is completely clear, patients feel like they aren't able to breathe in any air through their nose.
It's a feeling of a lack of sufficient nasal resistance in the nose. And the second symptom is a feeling of lack of sensation of airflow. So, for example, the lack of sufficient nasal resistance produces a difficulty in getting a deep breath. So I feel short of breath constantly, basically. And so that produces a significant amount of fatigue. On the feeling of suffocation, this lack of airflow sensation the brain seems to really want to know when you're breathing, which makes sense. And it seems to trigger a overactivation of the brain, sort of a fight or flight kind of sensation. And you always feel like you're not getting air.
So even though there is air flowing into the nose, your brain has no idea of that. Skinner says this makes it extremely hard to concentrate.
You can feel quite anxious. You kind of feel like you're on edge and can't calm down, even though there's really no psychological reason not to be calm. It's been quite challenging. I'll be quite honest with you. The first year of empty nose syndrome was extremely difficult. There were times where I did not know whether I could handle it.
In order to find some type of relief, Skinner will put cotton balls in his nose as a way to increase the air resistance. He's lived with this condition for more than a decade, and doctors still don't know what happens in surgery to cause ENS.
The surgery can go 100% according to textbook accuracy. I mean, it's exactly the way someone may want to do the surgery. But what happens is that in some cases, if the nose is opened too much, so the septum is made straight and the turbinates on the sidewall of the nose are reduced too much, then that leads to a very large amount of airflow. It's almost analogous when you think about sucking through a straw. You can sense that movement of fluid or movement of air through that straw. But if you made that straw the size of a pipe and you did that same maneuver where you suck on the pipe, you wouldn't appreciate the movement that's occurring. And we think there may be something to that relationship of just the size and the sensation of the airflow going through that causes people to have this condition.
The nose is an extremely complex organ, and turbinates are just one of the functioning structures inside it. They regulate airflow and warm the air you breathe in.
You have 3 turbinates that are stacked on top of each other as you go further back into the nose. But the big turbinate that causes a lot of nasal obstruction for patients, a lot of difficulty breathing through the nose, is the inferior turbinate, or the lowest turbinate. So it's a long, slim structure occupying that sidewall almost down to the floor of the nose. And that is a structure that we oftentimes will try to reduce the bulkiness of in order to help improve the airway, in addition to fixing the septum at the same time.
But Senior says if the turbinates are reduced too much, it can somehow cause ENS on rare occasions.
It is that paradoxical sensation where you have a very widely opened nasal cavity. I can look into it with a light or with an endoscope, and I can see things are very wide open, heading all the way back to the throat. And yet the patient feels that their nose is completely blocked. So despite the fact that physically it's open, they have very little sensation of airflow, allowing them to have a sense that their nose is actually open.
Senior thinks developing the condition may depend more on the patient instead of the actual surgery.
You could have the exact same physical result. We could do measurements. We can do something called acoustic rhinometry, which is almost analogous to like sonar in your nose. It creates this vision of the airflow going through the nose and showing us where blockages are. It can look exactly the same, and yet one person will feel totally blocked and the other person will feel completely great.
Unfortunately, Skinner was one that ended up being affected for life. Though it took a few months for the ENS symptoms to show up, he knew something was wrong right away.
Previous surgeries, I had recovered fairly quickly, but this procedure, I had an awful lot of bleeding. I ended up getting an infection. When I went back to see the doctor, he said there was exposed bone on one side. And then over the next, I don't know, I would say probably a few months, maybe 6 to 8 weeks, I really started feeling strange. Just felt like I couldn't catch my breath and just felt really unwell.
And when he returned to the doctor to try to resolve his new problem, Skinner says the surgeon was reluctant to believe him.
I think I ran into something that I think a lot of ENS patients ran into, and that this procedure is considered a fairly minimally invasive procedure that they do all the time. And, when they have a patient that comes back and says this procedure has dramatically changed their life, they seem quite skeptical. At first, he seemed a little bit open to it, but as time went on, I think he thought it was all in my head.
Over the next several years, Skinner participated in various research studies and sought out potential treatment options. Since the cause seems to be related to taking away too much tissue, why not just use an implant to replace what's missing? Well, Senior says it's not that easy. Turbinates are constantly changing, swelling at one moment, shrinking the next.
The turbinate actually has a cycle even where we can photograph the turbinate throughout the day, and we can see that one side gets a little bit more congested for a few hours, and then it just slowly decongests. And the other side oftentimes is doing the exact opposite. It's decongesting, and then it's swelling, and then it's decongesting. And there's like this rhythm that's going on. And it's a rhythm that we've actually been able to measure. And we see that rhythm even changing as a patient gets older. So it's quite a dynamic structure. The nose is a living, dynamic organ. And so just replacing the lost tissue with an adynamic, just static piece of something to block the airway, it just isn't perfect.
Desperate for a treatment, Skinner has tried injections. The first trial provided relief, but only for a short amount of time. Skinner then found a doctor in a Stanford University study who had created an injection using a longer-lasting material.
In 2018, I went out to visit him, and I had injections in my nose with a material that lasted a lot longer. And it was quite amazing, the results from that.
And though the injections were promising, they weren't a long-term solution. While scientists are still searching for a permanent treatment option, Senior has also started looking at potential indicators that can make patients more susceptible to ENS. His recent paper, published in the International Forum of Allergy and Rhinology, studied the relationship between ENS and mental health. The research found that ENS patients have a much higher rate of depression and risk of anxiety. But Senior says a more interesting finding is the elements of OCD present in the patients.
In particular, we found a condition called body dysmorphic syndrome was apparently present, or at least suggested by the questionnaires, in a very sizable percentage of the patients. And so that was a very novel finding. Body dysmorphic syndrome is a condition where patients tend to hyper-focus on a specific part of their body with an abnormality, and they can't not focus on it. And it becomes a very debilitating condition. It's been recognized in patients with abdominal pain, for example, or some GYN conditions. And it's also recognized in facial cosmetic surgery.
Senior thinks this discovery could open up new opportunities for treatment. And more importantly, further research could show that people with body dysmorphic syndrome are at a higher risk of developing ENS from common nose surgeries. Senior has begun to think about screening all his patients for mental health issues prior to surgery.
I don't want people and I don't want patients to think, oh, you're crazy. It's not a real condition that you're feeling. It's not a real physical condition. That's not at all what we're saying. We believe these sensations are real that they're feeling, but we do feel that some patients are more prone to this condition if they may have some perhaps underlying mental health issues that may make them more susceptible to feeling these intense feelings that so many of these empty nose patients have. And so we feel that it really is important to be aware of that, to try to treat the patient and give them the best outcome possible.
You can find out more information about James R. Skinner and Dr. Brent Sr. on our website, radiohealthjournal.org. Our writer-producer is Kristen Farah. I'm Reed Pence. Coming up next week on Radio Health Journal.
It's been 2.5 years, and I still, several times a day, just have smaller waves of shock roll over me now, where I'm just like, I can't believe he's gone.
How to support someone after a traumatic loss.
Then how Botox can help your overactive bladder.
If people fail medications or can't tolerate side effects, which common ones are dry mouth and constipation, then you move on to third-line treatments, including Botox.
All that and more on Radio Health Journal.
I'm Nancy Benson, host of Radio Health Journal. If you enjoy listening to Radio Health Journal, you'll also like our sister show, Viewpoints, which covers a wide array of topics from education to history to the environment. Here's a preview of what they're covering this week on Viewpoints.
If you're going to innovate, if you're going to build the future, it's not enough just to have a fancy pedigree or a really nice resume. Got to be clear what value you can add as a professional.
How to jump jobs in an economy that still favors workers. Then,
I believe that every region and every community across the planet should be able to feed themselves.
The struggle to keep America's farmland in the hands of farmers. I'm Marty Peterson.
And I'm Gary Price. These stories in depth this week on your public affairs magazine, Viewpoints.
Listen to Viewpoints on your favorite radio station and subscribe and listen to shows anytime on Apple Podcasts and Google Play.
And that's Radio Health Journal for this week. Follow us on Twitter, Facebook, and Instagram to learn more. And check Apple Podcasts, Google Play, and Spotify for a library of past programs. Plus, you'll always find previous segments and information about our guests at radiohealthjournal.org. Join us again next week for another edition of Radio Health Journal.